Good evening, I'm Sarah Diamond.
And I'm Josh Smith. We begin with our top story tonight. A deal to combine the region's two hospital systems is on hold. The very day the state of Tennessee faced a deadline to decide on whether Mountain States Health Alliance and Wellmont Health System should combine into a new company, they asked the state to give them more time.
The announcement took the region by surprise. Tonight's top story, where this hospital merger deal stands after an unexpected turn of events today. Mountain States and Wellmont announced in April of 2015 they needed to merge to improve the quality of local health care and to avoid being purchased by companies outside our region. The Federal Trade Commission stepped in to oppose the deal, which would drastically reduce local health care competition, they say. After months of answering questions and thousands of pages of paperwork, the former competitors finally got their application to merge deemed complete last September by Tennessee. And that started a 120-day clock for Health Commissioner Dr. John Dreisner to rule on the merger application and decide whether to grant what's called a Certificate of Public Advantage, or a COPA. The end of the 120 days was today. But instead of issuing a decision, Commissioner Dreisner's office announced the decision was delayed at the request of Mountain States and Wellmont. Turns out the companies earlier this week asked the state for more time to submit more information. We obtained this document outlining the agreement that the merger application would be changed from complete to incomplete. That means a decision on the merger will not come this week as expected. So, what happened? That's what News Channel 11's Carissa Winstead has been working to understand all day.
That's right. She joins us live outside Johnson City Medical Center tonight. Carissa, what have you learned?
Yeah, Josh and Sarah, around 11 o'clock this morning, Mountain States Health Alliance and Wellmont issued a release just minutes after the Tennessee Department of Health issued one as well, basically saying the decision was on hold. The hospitals wanted more time to give information, and the Commissioner of Health was willing to allow that to happen. But beyond that, neither of the companies nor the state are asking specific questions they're not answering them that we've been asking, refusing to talk on camera. Now, the request is to get more information and rule the application incomplete. That comes almost 4 months after the application was deemed finished. An application that contained thousands of documents submitted by the hospitals after a lengthy round of public hearings. Now, the health systems at one point last year made it clear that they were anxious for this process to wrap up. Local chambers of commerce even requested that the state basically hurry up. They sent a letter asking the commissioner for the decision, saying the conclusion of the merger is vitally important for our region and asking for the closure as rapidly as possible. And now this, State Senator John Lundberg today told us he's hopeful this delay is a good thing.
They're all going to pause and go, why? That's healthy, but I think what I want people to take away with is the due diligence is being done by three groups that are really important: Mountain States, Wellmont, and the state of Tennessee. If this is going to happen, it's really got to be perfect. We don't get a second shot at this, so we're going to do it right.
Now, the local chambers of commerce have been supporters of this merge since the very beginning. I spoke with Gary Mabry earlier today with Johnson City. Now, he told me he will continue to support the merge moving forward. He just hopes to see it done in a timely manner. Reporting live in Johnson City, Carissa Winstead, News Channel 11, in your corner.
So many tonight are asking what's next. It is unclear when the health systems will submit this new information, the specifics of which they are not revealing. When the application is ruled complete for a second time, that restarts that 120-day deadline clock. A decision, though, could come before the end of that time period. Late today, a spokesperson with the Federal Trade Commission, which has openly opposed this merger, told me, quote, "Only this, the FTC will carefully consider any new information the hospitals submit," end quote.